How does a bone marrow transplant work? Have you ever wondered how a bone marrow transplant can help someone with leukemia? This medical procedure is crucial for replacing damaged bone marrow with healthy marrow. Bone marrow is the spongy tissue found inside some bones, like your hips and thighs. It plays a vital role by producing blood cells, including red blood cells, white blood cells, and platelets. In leukemia, cancer cells invade the bone marrow, disrupting its ability to produce healthy blood cells. There are two main types of bone marrow transplants. The first is an allogenic transplant, where a patient receives bone marrow from a donor. This donor can be a family member or an unrelated person who is a genetic match. The second type is an autologous transplant, which uses the patient's own bone marrow. In this case, the marrow is collected, treated to remove any cancer cells, and then reinfused into the patient. The transplant process begins with preparation. Patients often undergo chemotherapy and sometimes radiation therapy. This helps kill cancer cells in the bone marrow and suppresses the immune system to reduce the risk of the body rejecting the new cells. Finding a suitable donor is crucial for allogenic transplants. Doctors will test family members or search through bone marrow registries for a match. Once a donor is found, the bone marrow can be collected. This is usually done through a method called apheresis, where stem cells are filtered from the donor's blood. After collection, the healthy bone marrow or stem cells are infused into the patient's bloodstream. They travel to the bone marrow and start producing new blood cells. Recovery is an essential part of the process. Patients are monitored closely for complications like infections and graft-versus-host disease. This condition occurs when the donor's cells attack the recipient's body. Recovery can take several months, and patients may need to stay in isolation to prevent infections. Bone marrow transplants can be a potentially curative treatment for certain types of leukemia. They provide a chance to replace damaged marrow with healthy cells, restoring normal blood cell production. Patients often requiring supportive care, like blood transfusions, until the new marrow begins functioning properly. While bone marrow transplants can save lives, they come with risks, including infections and prolonged recovery times. It is essential for patients to receive careful monitoring and support throughout this journey. Overall, understanding how a bone marrow transplant works can offer hope for those battling leukemia. Always consult healthcare professionals for personalized medical advice and support.